This is Sarah Meixel, and today we're here with Dr. Colin Lindsay. He is a veterinarian with Veterinary Consultancy Limited and does work in the UK and Europe. So thanks for being with us today, Colin.
No problem, Sarah. A pleasure.
Very good. Tell me a little bit about Mycoplasma bovis in dairy.
Well, it's a huge challenge in the UK and Europe for a variety of reasons. I mean, in the UK, we would actually qualify as being endemic in dairy and beef units, so it's widespread. Europe, it's very widespread as well. I don't know the exact figures, but it's a very common organism, and the problem with it is deciding the significance with any disease outbreak. It has a variety of manifestations. Typically in calves, it would be pneumonia, would be one of the primary presentations. Arthritis, polyarthritis, otitis media, or an infection in the middle ear, which would give you a head tilt.
Right.
So that would be your typical presentations in calves. In adult cows, what we've seen is you can have some severe outbreaks of polyarthritis.
Okay.
And these animals are extremely hard to treat at the point of, if you have an early diagnosis, you're actually better to slaughter the animal.
Right.
And it's interesting just now, it's very topical with the situation in New Zealand, where the working hypothesis there is that with a new introduction of Mycoplasma bovis to that country, so in that situation you're getting that rapid spread, or has been spread, you're going to get significant clinical signs, and it's going to have a huge impact. Whereas in the UK, we've got an endemic situation, so it tends to grumble on and give you subclinical and subproduction issues.
Right. So why is it such a difficult pathogen to identify, and kind of how can diagnostics play a role?
Well, that is a major challenge with Mycoplasma.
Right.
Part of the issue is it's a delicate organism. So it's if you've got a delay of getting your samples to the lab, you've got a high false negative rate, you just don't pick it up. Yeah. If you've got previous treatment with antibiotics, which is invariably the case, you're again going to suppress any decent growth. We, in our practice, we normally go with a mycoplasma transport medium. So if you don't have the right medium to try and get that organism to the lab quickly, you're really going to compromise your growth. Then the lab has to know what it's looking for. It's not just, you can't just use a standard culture technique, and you sometimes have to go for 21 days. So it is a problem to diagnose with culture. Flip side of that, historically we've had serology, but again in the UK, because it's endemic, what does it mean?
Right.
You know, because if we went and had a look at any of our production units, we'd come back with positives. So it's quite exciting now. We've got the PCRs. That is going to be good. At least we can get a handle on it. But it's the usual story with PCRs, in that you have to understand that if you get a positive, you have to link that up with your clinical disease. So it's just a bit of a health warning for clinicians. You have to have the disease syndrome and the positive diagnosis, and you link them both together. That's when you're confident of your ground.
Yeah.
But the organism itself, mainly it's direct transmission from animal to animal, nasal secretions, with the main way, coughing. Then once it's in the animal, the host animal, the problem you have there is that it can change its antigenic type. So once the animal's starting to mount an immune response against the mycoplasma, it can flip its characteristics. So then the immune system has to start over again. And it can produce biofilms. So, which again, that organism can hide within that biofilm. And then for our therapeutics, the problem we have there, it doesn't have a cell wall. So that automatically rules out a lot of our drugs that we can use, or antibiotics. So it's difficult to diagnose, it's difficult to isolate, and then once you do have a diagnosis, it can be very, very difficult to treat. And then within your larger herds, one of the big problems are asymptomatic carriers. So if you're buying in cattle, which is your main risk factor, they could look healthy enough, but they're going to be asymptomatic, and then you can get a disease episode. So it's a major challenge for the livestock industry.
Well, thank you so much for all the information today.
Okay, thank you.
Thanks, Colin. This is Sarah Mikesell reporting.